Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hey, Nita Valens, I bet you're having a great day, aren't you?
I am. How about you?
Living it up.
Well, that's what we're supposed to do, so we want all of our listeners to live it up. And we're going to take your calls all hour so that you can live pain-free. And what kind of pain are we talking about? Musculoskeletal pain, basically orthopedic pain, which means muscle pain, joint pain, tendon pain, ligament pain, disc pain, back pain, neck pain, knee pain, hip pain, arthritis pain, and stiff joints, dull aches. Maybe you don't even know the origins of it, but maybe Dr. Darrow can help you figure it out. Our number is 866-870-5752. Right here in the studio, call 866-870-5752. And when you phone the program today, you get Dr. Darrow's latest book for free called Stem Cell and Platelet Therapy. Regenerate, Don't Operate. It has 264 scientific studies. I counted. And you can go to the website, www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. And that's www.lastemcells.com. We're here Saturdays at 10, again at 1 p.m. And we love your calls. We have lots of information for you. And if you call, then we can individually customize that information. Right, Dr. Darrow?
Yes, we love our callers. It makes the show real interesting. So give me a call right now. You can talk to me at 866-870-5752. And if you missed the show right now and you hear it later sometime when we're not live, the phone number to my office, you can talk to me there and get a lot more information, is 800-300-9300. I'll repeat that also, 800-300-9300. My website, which Nita mentioned, has videos of me doing these procedures of regenerating the body, rejuvenating it, instead of operating on it and taking tissue out and causing lots of side effects. There are studies coming out all the time showing that these surgeries that are done for meniscal tears in the knee, rotator cuffs in the shoulder, you name it, anywhere in the body, are really not that good for the body. Sometimes people get relief for a while, then down the road they have more problems. It's like steroid shots, cortisone. It feels great when you do it, but then later the tissue is dissolved away and you have worse issues. It actually eats up the cartilage. So we try to stay out of the paradigm of what we call traditional medicine. Traditional medicine is surgery and drugs. We try to move to things that are natural. I take people off their medicines. And instead of cutting into the body, like I was trained in orthopedic surgery during my medical school career and internship and all that, I did a lot of orthopedic surgery. And I loved doing it. It is a lot of fun. But it didn't work out too well for a lot of people, and I am one of them. I was an idiot, you might say, while I was in medical school because I loved orthopedic surgery so much. And I had my boss operate on my right shoulder, and it did not come out very well at all. It wasn't his fault. It's just what happens with surgery. All you guys who listen to my show or patients that are listening now know that. So I was lucky enough to have discovered regenerative medicine. Today we use platelets or bone marrow, which has platelets and stem cells and exosomes and cytokines and all kinds of wonderful growth factors. And they're such easy procedures. You literally walk into the office and you get injections and you walk out. So there's very little morbidity to it, very little side effects to it. People get a little stiff afterwards. So please give me a call now at 866-870-5752. 5752. And actually, we've got a couple people waiting, so let's go to Mark in Palos Verdes.
Mark with a K.
Hi, Mark. This is Dr. Marc Darrow. I understand your shoulder is bothering you, so I was talking to the right guy. What happened to your shoulder, and how long has it been going on?
Well, you would know that because I'm an existing patient.
Okay. Oh, I know you. I can tell by your voice.
Yeah, how about that?
Yeah,
Surprise.
you're a funny man. Surprise.
Surprise. So, anyway, I have a joke for you.
I knew you would. Let's do it.
Okay. Did you hear about the dyslexic agnostic that had insomnia?
Whoa. Dyslexic insomniac.
The dyslexic agnostic that had insomnia.
Oh, agnostic. Okay. So it's someone that can't see straight and who, doesn't think there is a God, something like that?
He would lay awake at night wondering whether or not there was a dog.
Oh, that's so cute. Because, folks, what is dog spelled backwards?
We got it.
Great joke, Mark. Actually,
Okay.
Mark's been in a few times. His shoulders, from what I remember, is doing a lot better. Is that true,
Yeah.
Mark?
Yes, it
Okay,
is.
good.
And when I was in there last time, you did the PRP, and the next day it was way better.
Oh, good. We love to hear that. That's
So
a great
I've had a lot of
endorsement.
significant improvements since the last visit to your office.
And for you guys who are listening, you can tell by Mark's voice, he is a very honest kind of guy. He's a high-level entrepreneur, right, Mark?
Yes.
Yeah. So it's not some guy that I hired to get on the show here to talk about this. I really appreciate you making the call in, Mark, and I'm looking forward to seeing you, and I'm glad you're having real good success with bone marrow and stem cells and platelets, which is what we call regenerative medicine. Do you have any questions, Mark?
No.
You're just
Do you have
a
any more
happy guy.
jokes?
Oh, he
I have
has
a lot more
8,000
jokes.
jokes.
I can't tell on the radio.
Oh, okay. All right. We'll table that.
Well, you can save them for the office, for me and the staff. All right, Mark, God bless you. I really appreciate your call. That's so sweet of you to take your time.
Thanks, Mark.
All
Appreciate
right.
it.
Bye.
Our number is 866-870-5752 right here in the studio. Give us a call. The time goes by quickly. Don't wait till the last minute. You know, we had 6 people in the last 5 minutes last week. It was crazy.
Yep.
So 866-870-5752. Let's go to Howard in Los Angeles.
Howard, Dr. Marc Darrow, how are you today?
I'm doing very well, and you?
I'm doing great, man. You're not a patient, are you?
And I must say that I was not hired either. To
Wait,
speak
are
on
you
your radio.
are you a patient also?
No,
Okay.
no, I'm not a patient.
Okay.
I just got over shoulder surgery about 6 months ago.
Okay.
Had a graft put in.
Okay.
And it's feeling, it's I got range of motion back. It's feeling strange.
Yeah.
From I guess it's the graft, if I'm not mistaken, that is always going to. It feels like it's an irritant. You know what I mean? It feels.
Sure.
I feel it.
Okay.
Is that correct?
No, that's not correct, but it's a good idea. I'll
But my
put it like
true
this.
question-
Howard, let me say it like this.
Okay, go ahead.
When new patients walk in the door, they go, I feel like this. I feel like that. I think it's this. I think it's that. Most of the time,
Yeah.
they're not accurate because it's not the issue. But
Yeah.
I'll put it like this also. We all have feelings. We all have feelings, and our feelings change all the time. And I always tell people when they say, I feel this or I feel that, and in the new movement with the younger kids, they say everything I feel, okay? Because they
Yeah.
don't want to be wrong. They go, I feel. And feelings are not a good way to express yourself. It's a good way to care for people and use your emotional energy to make people feel good. But it's not a good intellectual way of expressing. because feelings change.
Okay.
You feel one way 1 minute, and 5 minutes later you feel something else. So I don't really, when people talk about I think or I feel, I automatically discount it. Because all those things, the mind
Because
changes and the feelings
I do
change.
not know. Yeah.
No, you don't know. But we can say this. You sounds like you had some success with that surgery because you got your range of motion back. And it's still not perfect. And the other question that you haven't asked, which I'll ask for you, is can regenerative medicine help get rid of that irritation? The answer is most likely yes. We could probably use PRP or stem cells or combination to heal that shoulder up. And it sounds like the problem you had before was adhesive capsulitis. You had lost some range of motion, what we call a frozen shoulder. And in my book, you don't get surgery to fix that. That's like using a cannonball to kill a mosquito. Okay, you don't do that.
Well, you
don't need that.
I felt like the rubber band just snapped.
Yeah.
And I couldn't. That's why I had the surgery.
No, I understand, but that's your feelings, and I get tons of people with rotator cuff tears. Most people that I treat with shoulder pain have rotator cuff tears, and most people who get a little bit older have rotator cuff tears and don't even feel it. So, one of the things we have to let people know about is the studies all show that you can have a rotator cuff tear in your shoulder and not have any pain, because we take people that have zero pain in their shoulder or anywhere else in the body, and we'll do an MRI and we'll find terrible things. So unfortunately, what surgeons do, and I'm not putting them down for this, it's just the culture of surgery. I love surgeons. They save a lot of lives, and if you have bones sticking out of your leg, you better get right to the surgeon and have them patch it up. But these other kind of surgeries for these things that they find on MRIs, in my opinion, my little old opinion, just Dr. Marc Darrow, I'm not saying this is the world or God. In my opinion, they should never be done. Mm-hmm. The studies show they don't work. And I get people in all the time, new patients walk in the door with failed surgeries. That means they had a surgery that the doctor said, the surgeon said, this will make you better, and they get worse. And I'm one of them, and that's how I know it. Mm-hmm. My boss in orthopedic surgery operated on my right shoulder, and it got terrible after the surgery for a few years. I think it was 4 years when I discovered regenerative medicine. I injected my own shoulder, and you'll laugh at this. My wife was watching TV in bed, and I jumped in bed, and I had my syringe in my hand. I injected my shoulder lying in bed, and she was screaming at me with some expletives. What the are you doing? And I said, I'm going to try this on my shoulder. I woke up the next morning. I had full range of motion, and it was pain-free. Okay? So that was a wake-up call for me that there's something else besides surgery, and I loved doing surgery. Loved it. It's a real, it's a guy thing. That's all. The only way I can put it is, you get into this operating room, and there's a lot of people at your command. And most orthopedic surgeons have their rock music blasting, and it's a fun time. But after that, I switched horses midstream, and I started doing regenerative medicine. And it's been a godsend for me and most of my patients. Doesn't work on everybody for several reasons.
Sure.
The reasons, I talked about this on the last show last week. A lot of people get regenerative medicine of platelets or stem cells, and then they're too active afterwards. So even though they're getting better and tissue is growing, they don't feel better. So they blame it on the treatment. It's not the treatment's fault, it's the patient's fault. Number two reason is people take anti-inflammatory medicines like ibuprofen, and that blocks tissue growth. So all you folks who are downing anti-inflammatories, you are hurting yourself. I'm just going to say it the way it is. It's not good for you. It also can blow out the tissue in the stomach and have you bleed to death. I've had 2 people during my internship that had that problem. We had to pump them with blood all night long. Number 3, people don't get enough treatments for whatever reason. They'll get a treatment, and then they'll come in and go, it didn't work, and then they'll quit. Number 4 is they have a doctor that doesn't know what he's doing. Most doctors who do this stuff have no clue what they are doing. I had someone come in yesterday who went to another doctor, and I said, how many pokes did you get in your shoulder? Because it didn't work. They said they got one poke. Well, one poke doesn't work in a shoulder. The shoulder is so complex, the huge range of motion. It's got the four rotator cuff tendons. It's got the subdeltoid bursa. It's got the joint. It's got the AC joint, and the glenoid joint. There's just too many things going on. It needs a lot of pokes, unfortunately. And then the fifth thing is...
Well, I'm going to have to make an appointment.
The office number is 800-300-9300. I'd love to see you touch the area. I don't rely on MRIs or X-rays. I rely on my hands and the examination, moving you around and touching you and finding out what's going on. Because I have to find the pain generator. Where is the pain coming from? We know, every doctor should know by now, you cannot trust an MRI or an X-ray to show you where pain is coming from. And unfortunately, surgeons are still using those images to decide where to cut when there shouldn't be cutting anyway. I'm not putting down the surgeons. I love them. But they have a culture that is outdated. There's way too many of these surgeries done. There's study after study showing that they don't work. So,
well, can I move to a different part of the body?
Only if it's your foot.
It is my foot. It's my huge bunion that I have, and wanted to have surgery for 20 years, but it is really a large bunion. I heard on your program that you said something that it's actually arthritis. Is that what I heard? Was that correct?
Well, that's what a bunion is. A bunion is arthritis. You don't have stability on the bottom of your foot. So when you put your foot down each time, that joint kind of splays, and there's a lot of pressure on it, and then it becomes arthritic, and then the bone starts to grow. So if it's a giant piece of hyperostosis, that's arthritis, just meaning the bone has overgrown. I can't get rid of that lump, okay?
Yes.
If it's the lump that's bothering you, the cosmetics, you have to have that shaved off. If it's the pain, I would make orthotics for you and take the pressure off that joint and then inject the joint with stem cells and platelets.
Yes. It's the cosmetics.
So I have
no pain. I have no pain.
Yeah, the cosmetics I can't handle. You have to take care of that surgically. Yeah.
Thank you.
But the other point of it is, even if you take care of it surgically and get rid of the lump, that bony lump, it's going to come back because the foot is unstable. So you're still going to need properly made orthotics, not the kind you buy off the shelf at Foot Runners or some online thing. You've got to have them made to fit your foot.
Yes.
Podiatrists do that. I can do it also. Okay?
Great. Thank you. I will call
Howard, God bless you. A lot of good information coming from your call. Any other part of your body bother you?
Not at this time.
Not even a big tummy? Your big tummy doesn't bother you?
Well, yes, I am living large. I'm overweight.
So I'm just gonna put this out.
Yeah.
I'm gonna put this out. Anybody that comes into my office that has a tummy, we talk about it, and I put them on a ketogenic diet. Just look up keto, Keto.
Yes.
And one of my best friends came in. I haven't told this story for a while. At 317 pounds.
Oh my God.
When we were young together, he was probably around 170, and then he ballooned up over the years. And I put him on a keto diet because he fell on his knee, and I aspirated I put an ultrasound on the knee. I saw a giant collection of fluid. I aspirated out, I think it was 90 cc's of blood. That's a lot.
Yeah.
And then I told him to go get a knee replacement because his knee was trashed. I had an MRI that was just trashed. He was miserable. And he said, I didn't come here for a knee replacement. I came here for you to fix it using stem cells. And I said, I'm not going to do it. He goes, why? Because I'm fat? And I go, yeah. We're good friends. I don't want to be a failure. He goes, I'll do whatever you want, but I'm not going to get surgery. He lost 100 pounds very quickly. Okay? I'm going to tell you his diet. You won't believe it. And I had him text me every single morning with what he ate the day before and what his scale showed him, what the weight was. He lost about half a pound every single day, and we did fix his knee. It took a few treatments, and he's fine. So,
fantastic.
If you're ever going to have someone inject your shoulder, your knee, your hip, make sure they are using an ultrasound to guide the needle. Otherwise, they're going to miss that joint.
Yes.
And make sure they're not giving it one poke. A shoulder needs a lot of pokes. I know the orthopedic surgeons are used to using steroids where they put it in the subdeltoid bursa. They think they're putting in the joint. They're not. I know it because I was trained that way. And then I used an ultrasound to guide it, and I saw that I was not even going into the joint. The studies show that we as doctors who inject without ultrasound guidance are missing the joint about 1/3 of the time. So be careful, guys. Be careful who's injecting you. Make sure the person's properly trained.
Yeah, my doctor approved me to go out and chip and putt, but he told me lay off the driver for a while.
You mean for your foot or the shoulder?
Golf. He said chip and putt.
Okay, I know.
But don't hit the driver yet.
Because of your shoulder.
Yes.
Yeah. Well, I would say something different. I would say fix your shoulder.
Yeah. Yeah.
Because what you have, what you're calling that irritant, the graft that was put in there, is not the problem. The problem is your shoulder's not healed. So I would say get some regenerative medicine, put some platelets in there, maybe stem cells and platelets. Get it fixed.
I agree. Thank you.
Then go out and play golf and hit the driver.
Thank you. Yeah. Then hit the driver.
Yeah. I wouldn't start chipping and putting because you're going to cheat.
Yeah. Yeah.
You know what cheating means when you chip and putt?
No.
I'm just going to hit 1 9-iron.
Yeah.
Oh, that worked good. I think I'll just hit 1 6. Oh, let me get the driver. And then before you know it, you're swinging at 120 miles an hour and you blow your shoulder out.
I don't want to do that.
Don't do it. Wait till you're better.
Yeah. Okay.
Remember I said the failures come from activity? That was the first reason that people fail with regenerative medicine and with surgery. Do you know how many ACL repairs rupture again?
Oh, yes. My daughter's had
the ACL is the anterior cruciate ligament.
Yes.
Yeah, they get it fixed. They take cadaver or the middle third of the patellar tendon or the hamstring tendon, and they pull out the old ACL and they plug in a new one, and then it rips again because the patient was too active too soon. Uh-huh. It takes a good 9 months to a year for that ACL repair to actually function properly. So activity is the father of injury, especially after treatment.
I guess I won't chip and putt yet then.
Well, if you could have someone watching you with a gun to your head and make sure that's all you do, you're probably going to be okay. But you won't do it. How do I know? Because I've had the same issue and I didn't do it.
Yeah, yeah.
I've had shoulder injuries. I've had injuries all over my body. And I go out and I chip and putt, and then in 15 minutes I'm hitting the ball 280 yards with the driver. It's
I don't want to try that
Golf
yet.
is very seductive.
Well, I'm going to come in and make an appointment and see you. Sounds good to me.
All right. For those listening, the phone number to the office, if you want to come in and have me check you out, I can tell you usually in 1 minute, if I can help, is 800-300-9300. I'll repeat it, 800-300-9300. And I have people come in almost every day who were told they have to get a surgery, and I touch the area, move them around, and they never needed a surgery.
Okay.
Hang with us, guys.
All right. You're listening to Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil. Write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back. Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.